If you're turning 65 and you still have health insurance through your job, you might be thinking, I'll just stay on this and deal with Medicare later. And for some people, that's actually the right move. But for other people, that one decision can actually lead to much higher costs than anticipated. And the difference usually comes down to one thing that many people have never even heard of. It's called coordination of benefits, and it decides whether your employer plan pays first or whether Medicare pays first. And if this isn't set up correctly, your coverage may not work in the way that you expect it to. And that's even if you've had the same plan for years and even if you're still paying for it every month. So in this video, I'm gonna show you exactly how Medicare and your employer plan coverage work together after the age of 65. And I'll show you the key rule that will help you determine whether or not you may be able to delay Medicare and the most common mistakes that people make that end up costing them more money over time. Hi, my name's Eric and I'm a licensed Medicare agent. Now, many people assume that as long as they have health coverage, they're fine. They think it doesn't matter where it comes from. It could be a job, COBRA, a retiree plan, or even Medicare. The assumption is simple. Insurance is insurance. And honestly, that can make a lot of sense because that's usually how it works for most of people's lives. You have your card, you go to the doctors, and your insurance handles the bill. But Medicare doesn't always work that way. Medicare has specific rules regarding which plan pays first and which one pays second. And if those rules are not followed, your coverage might not work in the way that you expect it to. And so this is what's called coordination of benefits. And it can have a bigger impact than most people realize. And that's because when you have more than one type of insurance, one is considered the primary payer and the other is considered the secondary. So the primary payer is first in line. It gets the bills, pays its share, and then passes whatever is left over to the secondary payer. The secondary payer only steps in after the primary payer has done its part. And now here's the key thing to understand. The secondary plan doesn't just take over everything. It only pays according to its own rules and limits. And that's where problems can start to happen. Because if the plan that's supposed to be primary is not in place, then the secondary plan may still pay something, but not necessarily the full amount that you expect. And this remaining cost can actually fall back on you. So for example, if Medicare is expected to be your primary insurance, but you never enrolled, then your employer plan may only pay the portion that they're required to pay as a secondary payer. So how do you know which plan is supposed to be primary? Well, it often comes down to one key rule, and that's the size of your employer. If you're over 65 and have health coverage based on current active employment, here's how it generally works. If your employer has 20 or more employees, then your employer plan typically pays first and Medicare pays second. And in those situations, many people are able to delay enrolling in Medicare Part B. And that's because your employer plan continues to work as your primary coverage and you can hold off on paying the Medicare Part B premium until you retire. Then when that coverage ends, you usually have an 8-month special enrollment window to sign up with Part B without a late enrollment penalty. But if your employer has fewer than 20 employees, the rules change a little bit. In those cases, Medicare is typically expected to pay first and your employer plan becomes the secondary payer. And in those situations, you do typically need to enroll in Medicare Part B when you become eligible. Because if Medicare is supposed to be primary and you didn't enroll, your employer plan may only pay a limited portion of the cost, which is the amount it would normally pay as a secondary plan. And that can leave you responsible for more of the cost than you may have expected. So here's a simple way to think about it. If your employer has 20 or more employees, you may be able to safely delay Medicare Part B. If it has fewer than 20 employees, then you might want to take a closer look at enrolling in Medicare when you become eligible. And the easiest first step to take if you plan on working past the age of 65 is to ask your HR department how many employees your company has. And that's including all locations. But there's another rule that also trips a lot of people up. And this is where many of the biggest mistakes happen. It has to do with COBRA and retiree coverage. So here's the key idea. Even if your employer has 20 or more employees, your coverage only qualifies for delaying Medicare if it's based on current active employment. That means either you or your spouse are still working and that the coverage is tied to the job. And it typically does not apply to COBRA, retiree plans, or severance plans. And you see, this is where the confusion comes in. Because from your perspective, you may see that, well, I still have insurance, you're still paying for it, and it may look exactly the same. But Medicare does not look at it that way. Medicare's rules are based on active employment, not just having coverage. So if you're no longer actively working, that coverage usually doesn't qualify you to be able to delay Part B. And this is a very common situation for retirees around the age of 65. And this, for example, is because someone retires around the age of 65, they elect COBRA to keep their coverage for about 18 months and then assume they can deal with Medicare later. But what they don't realize is this: their special enrollment period for Part B typically starts the moment they stop working and not when COBRA ends. So while they're on COBRA, that enrollment window is already running in the background. And by the time COBRA ends, they may have already missed that window. Now, when that happens, a few things can follow. First, they may face a late enrollment penalty on Part B. Next, they may have to wait for the next general enrollment period to go ahead and sign up. And lastly, there may be a delay or a gap of when their coverage actually begins. And during that time, their COBRA plan may not have been covering costs in the way that they expected, because Medicare was expected to be primary. So even though everything looked fine on the surface, the coverage may not have been working the way they thought it was. So now we've covered two of the biggest rules to be aware of, but there is one more piece that's important to understand. And this one works a little bit differently than everything we've talked about so far. Because up to this point, we've been talking about Part B, which is your medical coverage. So that's doctor visits, outpatient care, things like that. But Part D, which is your prescription drug coverage, follows a completely different set of rules. And this is where a lot of people get confused, because the rules for delaying Part D do not match exactly the same rules as delaying Part B. Part D works a little differently, and it's based on something called creditable coverage. And all that means is this: your current prescription drug coverage is expected to pay at least as much as a standard Medicare drug plan. If your coverage is considered credible, you can typically delay enrolling in Part D without penalty. But if it's not, and you go 63 days or more without enrolling in that type of coverage, you may face a late enrollment penalty when you sign up later. And that's where this starts to matter, because this is one of the areas where a lot of people get tripped up. And that's because COBRA and retiree plans are often considered credible drug coverage, even though they don't qualify you to delay Medicare Part B. So you may end up in a situation where your coverage qualifies you to delay Part D, but not for delaying Part B. And that's where a lot of the confusion comes in. And so to help with this, your employer is required to send you something called a notice of creditable coverage each year, usually around September. And it's important to keep that letter because you may need it later to prove that you did have credible coverage. And here's something else to keep in mind: the standard for what counts as credible coverage can change over time. So even if your plan qualified last year, it's still a good idea to double check and make sure that it qualifies this year. And this is especially important if your coverage or if your employer has changed at all. So before you make any decisions, here are a few things that are important to check with your HR department. First, how many employees does your employer have, including all locations? This will help you decide whether or not you're above or below that 20 employee threshold. Second, is your coverage based on current active employment? You'll want to confirm that it is tied to a job that's still active and not COBRA or retiree coverage. Third, is your prescription drug coverage considered credible? It's a good idea to get that confirmation in writing and to keep the notice of credible coverage when it arrives. Fourth, what happens to your spouse or dependents when you leave the employer plan? Medicare does not work like a family plan, so it's important to see what your options are ahead of time. And fifth, if you have a health savings account, when should you stop contributing? In general, once you enroll in Medicare, you're no longer able to contribute to an HSA. And because some Medicare coverage can apply retroactively, it's important to confirm the timing so you don't run into any unexpected tax issues. So taking a few minutes to get clear answers to these questions can make a big difference and help avoid surprises later on. So before you turn 65 or before you leave your job, sit down with your HR department and get some clear answers. And if you're not sure where to start, you can also get help from SHIP, which stands for State Health Insurance Assistance Program. They offer free, unbiased Medicare guidance in every state, and they're not tied to any insurance company, so I'll go ahead and put the link below. And you can also call 1-800-MEDICARE if you want to speak with someone directly. Even a short conversation like this can help you avoid issues later on. Now, if you're thinking about delaying Medicare and you want to understand how to do it the right way, there are a few important rules to keep in mind. So in this next video, I'll walk you through exactly how to delay Medicare safely and what you need to know to avoid potential penalties or gaps in coverage.